Also. I've started recording, so please continue, sir.
Sure. So good morning, good afternoon, and good evening, everyone. It's 11 p.m. here in Canberra, 5:45 p.m. in Kathmandu, and 7 a.m. in the east coast of the United States. Welcome to the 14th webinar of the IIDS on politics, economy, and public policy. The seminar is scheduled first Monday of every month. However, as our speakers, moderators, and participants come from all over the world, this month we had to change our schedule for the second Monday due to the New Year's public holiday on first Monday of January in different parts of the world. We also have an organizing committee to run this webinar. I am Sudhimna Dahal, PhD candidate at the Australian National University here in Canberra. We have Dr. Pavin Parka, Assistant Professor at the University of Essex in the UK, Samar Rana and Devika Thapa from IIDS Kathmandu. We would like to thank Binisa Nepal for her wonderful work in coordinating the webinar up until recently, who has left the IIDS. We would like to wish her all the best. Without delay, let me introduce to our panel today. Our speaker for today is Ms. Jyoti Pandey. Ms. Pandey is a social protection specialist at the World Bank Group, where she works on improving government policies programs for the poor and vulnerable. She holds a master's degree in public policy from Hertie School of Governance, Germany. She is one of the lead authors of a research work recently published by the World Bank entitled Review of Public Expenditure and Assessment of Social Assistance Programs. She will be presenting her first chapter of that research today. Our moderator and commentator for today is Mr. Hari Sharma. Mr. Sharma comes with rich experience in academia, government, think tanks, and public policy in Nepal. He is currently associated with Social Science Baha and the Alliance for Social Dialogue. He has 15 years of teaching experience in various academic institutions and was a Fulbright scholar at Cornell University. He has co-authored 2 books and regularly contributes to Nepal's national dailies and TV debates. He served as Principal Secretary to Prime Minister Girija Prasad Koirala on several occasions between 1991 and 2001, and was the advisor to Dr. Ram Varan Yadav, the first President of the Republic of Nepal. Social protection and social assistance are one of the most important issues in Nepal, and the COVID shock has further emphasized its importance. Nepal is generally associated with Vriddha Bhatta, while its coverage is much bigger, which Jyoti will explain today. It is very much under research area in Nepal, but very much politically contested as well. Some kind reminder for our ground rules. Please keep your mics muted unless you are invited to speak. Ms. Pandey will speak for about 30 minutes, followed by a few minutes of commentary by Mr. Sharma. We will then open up the floor for questions and comments. Please use the chat forum to ask your questions or raise your hand using Zoom feature. Ms. Pandey, the floor is yours.
Thank you very much, Sudhimnaji. Thank you for inviting me to share the research that the World Bank recently released. I will now share my screen. So as Sudhimnaji pointed out, this presentation is based on a public expenditure review that the World Bank recently released a few months back. The report actually covers quite a lot more ground than what I'm going to speak about today. My presentation is focused on chapter 2, which looks at how much Nepal spends on social protection and a bit more detailed analysis of social assistance. And I'll explain the difference between social protection and social assistance in a bit. And look at ways to address these challenges and how much it is estimated to cost. Chapters 3 and 4 of the report talk about delivery of social protection in a federal context, and perhaps service delivery in a federal context can be a topic for a whole another webinar in the future. I will proceed now, starting with how we define social protection. Especially at the World Bank, we refer to social protection as a set of programs and systems that help individuals and households, especially the poor and vulnerable, reduce poverty, cope with crises and shocks, find jobs, invest in human capital, invest in health and education of their children. So it's meant to look at poverty reduction, help people cope with crises due to life cycle risks, as well as other shocks and disasters, as well as promote human capital. There are typically 3 elements to social protection, what we call social insurance, which is the contributory part of it, typically public sector pensions or health insurance or other contributory schemes. The second one is social assistance, which is a non-contributory part, which is provided to the poor and vulnerable without any contribution from the individual. These typically include cash transfers to the poor and vulnerable, school meals program, scholarships, and health subsidies. And there's a third element, which is labor market programs, which includes skills building programs or support to labor market transitions and such. If we look at the programs in Nepal, Nepal has quite a large portfolio of programs. In this slide, I present a table of the key programs. This is not an exhaustive list of the programs in Nepal. There are many, many more. And depending on how you count, there's a range of 30 to 80 plus programs in Nepal. I'll go through a few that are the major ones in each category. In social insurance, the largest is the public sector pension, which is the pensions to civil servants, teachers, army. Until 2019, the public sector pension was non-contributory in Nepal until new legislation was approved in 2019, which established a pension fund. And for new recruits into the civil service, it is now contributory. There's the Employees Provident Fund, which is a mandatory retirement savings scheme for those in the civil service, as well as open to the formal private sector. There are schemes under the Social Security Fund, which was launched a few years back, which includes 4 schemes looking at medical, accident and disability, survivor benefits, and old age benefits. And then there is the National Health Insurance Scheme, which was launched a few years ago, has been now rolled out to all the districts in the country. And this is a scheme whereby a family of 5 pays 3,500 rupees for an annual coverage of up to 100,000 rupees. Under social assistance, the largest program and the most sort of well-known is the Social Security Allowances, which is cash transfers to senior citizens, single women, those with disability, endangered ethnicities, the 10 groups, communities which are labeled endangered in Nepal. And then children under 5, Dalit children across the country, and all children under 5 in selected 25 districts. The other large program is the Prime Minister's Employment Program, which is relatively new in its 4th year, I believe, this fiscal year. This is a cash for work program, which is intended to be a minimum employment guarantee, which provides 100 days of work to the poor and vulnerable who register for it. Under Ministry of Education, there are scholarships, over 15 schemes of scholarships. This midday meal program, which is now available to all schools, all public schools, community schools for children in pre-primary and primary level. Then there's the Safe Motherhood program, which provides cash incentives for women to deliver a child at the health facilities, and it's meant to cover the transportation costs to reach a health facility. The labor market part is quite underdeveloped in Nepal. The large 2 programs are YSEF, the Youth and Small Entrepreneur Self-Employment Fund, which provides collateral-free loan, and a program called Event, which provides skills to certain categories of people. I now move to talk about the expenditure trend. The expenditure in social protection overall is quite substantial, and it has been increasing quite a lot over the last several years. In the last 10 years, between 2010 and 2020, the nominal expenditure increased over 5-fold. And in the same period, the real expenditure also increased about 3 times. We did this research and analysis mostly in 2020 and were a bit delayed in releasing it. So the data, the expenditure data is from 2019. The allocation data is from FY20. But I believe the trends still hold coming to this fiscal year as well. So in fiscal year 19, the total expenditure was 134 billion, and the estimated share of GDP was about 3.5%. In 2020, the allocation increased to about 189, and the estimated share of GDP was about 4.8. In 2020, again, the allocation has increased substantially. It is over 200 billion now, and I believe the share of GDP has also exceeded, but I don't have an exact figure with me. If we look at the composition of expenditure, it is dominated by public sector pensions, which forms the majority of the social insurance. In 2019, that constituted 56%, and social assistance 41%. Labor market, as I said earlier, is a very small part of the social protection expenditure. And if you look at share of GDP, insurance is 2%, social assistance 1.4%, and labor market at 0.1%. If we look at the breakdown of the social assistance, the non-contributory part of it, the larger programs are the SSA, Safe Motherhood, Karnali Employment, and RCRW, which were cash for work programs, which have been discontinued and replaced by PMEP. There's also the Poor Citizens Medical Treatment Fund for certain diseases for certain groups. And the total in 2019 was 85 billion, and you can see the largest is the SSA. Looking at the expenditure relatively, Nepal spends quite a lot in comparison to other countries as well. Again, this is data from FY 2019. I believe the share has increased this last year and this year. Looking at 2019, it was 1.4% of social assistance. And in South Asia, we are only behind India. Looking at income levels, we are at par with lower middle income countries. And looking at regionally too, we are only behind Europe and Central Asia. Now moving into social assistance in particular, and what are the challenges there? We didn't want to spend too much time in public. In this particular report, we didn't want to look at social insurance as such, but focus on social assistance. The expenditures have led to some positive outcomes, and I must highlight those before I move into describing the challenges. So if we look at certain schemes, the Safe Motherhood Program has been linked to increase in the rate of facility deliveries and an associated decline in maternal mortality rates. The midday meal programs has been associated with increase in enrollment rates and decrease in absenteeism in school. The impact on actual learning outcomes is not so clear, perhaps not really there. Child grant, which is the cash given to children under 5, to Dalits and select children in 25 districts, has been linked to increase in birth registration rates. However, the child grant is actually meant to be a nutrition grant and sort of meant to achieve nutritional outcomes, but given the benefit size, which is 532 rupees per month this fiscal year, and used to be 102, it started with it being 200 rupees, and the studies conducted around then, it hasn't really sort of achieved much outcomes in terms of nutrition itself. So looking into the challenges, the first one is a very fragmented policy context for social protection. The second big challenge is if we look at the life cycle from early years to sort of old age, the investment in early years is very limited and relatively. The third challenge, if we say social protection is meant for poverty reduction, the coverage by these programs in Nepal is very limited, and therefore the impact on poverty is very limited. And finally, and very importantly, more recently, the programs in Nepal are not flexible or responsive to the shocks that households face. And I will describe each of these challenges in a bit more detail in the subsequent slides. So starting with the policy context. So there's a very robust constitutional basis for social protection in Nepal. Right to social security is a right. There's a right to employment, education, health, food, housing. All of those are fundamental rights. However, each of these rights sort of stand on their own, and the programs that have been derived from these rights also stand on their own. There isn't an overarching policy framework that brings these together to deliver social protection effectively for the poor and vulnerable. And also because each of these rights and programs speak to only one aspect of social protection, the overall objective of social protection in Nepal has not been defined very clearly. So there is a right to social security for certain groups written in the constitution: the elderly, the economically poor, people with disability, people who cannot look after themselves, and there's a few more categories. What the right to social security did was just to say that transfers of the services provided to these people is social security. It didn't really define social security as such, did not define the objectives of the social protection. So there's some problem at the policy level because of that. And the programs are scattered across many, many agencies. Ministry of Home does the larger cash transfers, Ministry of Education has its schemes, Health has its schemes. And it's okay that programs are scattered across agencies. They need not be in one place. However, there's very little sort of operational coordination across these, which is a problem in terms of implementation. Finally, I must note that there is a National Social Protection Framework being drafted for several years now, with the National Planning Commission leading it. The last I know of that was the framework was approved by the Planning Commission and forwarded to the Cabinet, but the Cabinet sort of returned it for some amendments, and I think that's where it stands now. The second issue is to do with the spending across the life cycle. If we look at the expenditure, the share of expenditure of the total in social assistance in 2019, 51% went to the elderly and only about 8% to pregnancy and early childhood. If we look at per capita, the difference is very stark. And again, this is 2019. Since the SSA for the elderly has been increased substantially this year, the discrepancy would be even larger. And this is driven primarily by the benefit size of the Social Security allowances. Here I present the evolution of the benefit size. As we know, this started in 95, 96 with 100 rupees for the elderly, which has now been increased to 4,000 rupees over the years. The child grant started at 200 rupees in 2008-9 and is now 532 rupees. The increase in this year's budget was to increase all the benefits by a third, which means the smaller ones remained rather small. The third challenge I want to talk about is the coverage of the poor. So overall, a third of the population is estimated to be covered by social protection. However, the poor and vulnerable are not covered adequately. And this is for two reasons. One, by design, they're not targeted. The second, because of implementation issues, they're not covered. So if we look at those that are currently eligible, so if we look at the persons with disability, the estimates of undercoverage range from 13 to 47%, depending on which survey and what timeline you look at. If we look at child grant, again, across the different districts, there are estimates of undercoverage that range from 16 to 49%. So these are groups that are already eligible, but not receiving benefits. And another area that is sort of undercovered is health shocks, and health costs are really high in Nepal. Households are estimated to spend over 55% out of pocket, but the health insurance program remains rather new. The coverage remains rather low for various reasons on both demand and supply side. So if we look at the coverage of the poor, here I present two graphs derived from two different surveys. On the left is a graph derived from the Household Risk and Vulnerability Survey. This was a survey conducted by the World Bank over 2016, 17, and 18. It was a panel survey of about 6,000 households, only covered the rural areas though. So among rural households, less than 40% of those in first and second quintile are covered by existing social assistance programs. The graph on the right is from MIX, which is more recent, based on 2019 data. Here too, the numbers are slightly higher, but it includes retirement pensions, which adds a bit. The panel on the left is only social assistance. Still, even at 55%, to say 45% of the bottom quintile are not covered by any social assistance is a big gap. Given that context, if we want to look at the impact of poverty, it's very difficult to talk about the poverty impact because the programs are not intended to reduce poverty. So how do we even talk about what is the impact? Is it okay to say whether old age allowance is supposed to reduce poverty or not? The benefit size is same across wealth status. Everyone over the age of 70 is eligible. But if we do look at the analysis of whether there is a poverty impact, if we look at NLSS data, which is really old now, only 0.5% a reduction in poverty headcount could have been attributed to that. More recently, the benefits have increased. Looking at 2016-17 annual household survey, about 2.2% sort of reduction in poverty could be attributed to SSA. There really aren't any other sort of surveys that estimate poverty impact of social assistance. Now going into the fourth area of challenge, which is about shock responsiveness of the current programs. So survey data tells us that 1/3 of the households face at least one shock a year. And here by shock, I mean natural disasters, economic shocks, and things like that. And if we look at COVID, there have been multiple surveys. I believe the figures I've quoted here are from the UNICEF survey. There has been severe impacts on households, about 50% lost job in a certain reference period, people struggling to feed, and children's nutrition being impacted severely. However, the current programs in Nepal by design and policy are static programs that sort of address static vulnerabilities and are not flexible to change when there is a shock. And the idea of shock responsive program is that they can deliver assistance faster and more efficiently. And what I mean by that is the shock responsive would require that in a normal time, programs would cover the most poor and vulnerable, and are flexible or scalable in times of disasters to cover more people or deliver more benefits to the same group of people who are considered vulnerable. And the idea is that every shock affects the poor and vulnerable more, and they should receive more assistance. So the graph in the left, the y-axis is benefit amount, the x-axis is population. So the gray sort of square says people that are covered normally in normal times, and the expansion is during times of crisis. So to have a program that is scalable, what we need is mechanism to identify people who are poor and vulnerable, receiving assistance in normal times, and then people who are likely to be affected by disasters and shocks. So a data system is crucial to this. Second, the programs have to be scalable in design. So if we look at the two larger programs, social assistance, social security allowance, and Prime Minister's employment program, neither of those programs says in times of a crisis, certain aspects can be changed or larger benefits can be delivered. Each modifying any of these would require a high level sort of executive decision. During COVID, at least last year, there were conversations because for Prime Minister's employment program, which is a cash for work program, and because work could not be implemented during COVID, during the lockdown, whether cash could be provided without the work unconditionally, because the target groups, people who have registered, are the poorest and the most vulnerable. However, that conversation didn't really go anywhere. And the guidelines remain as they are. And the third aspect that's required for shock responsive social protection is contingent financing that is linked to these programs. In Nepal, the disaster risk management side has its sort of financing and provides disaster relief. The social protection program sits sort of in parallel. There's very little coordination across the two. There's increasingly recognition that it should be linked, but not quite the case yet. And finally, there's an additional thing which we haven't really gone into much in the social protection discourse in Nepal. So the existing programs focus on singular intervention. So it's either a cash or a service or a training, but on its own and not linked to each other and not provided to the same target group. What that does is it limits its impact on human capital and economic inclusion. What I mean by human capital is the investment through nutrition, healthcare, quality education that we do in individuals so they lead a more productive life. Similar idea in economic inclusion. Poor and vulnerable households face multiple constraints. Their need is never just cash or just service or just access. So the programs that look at economic inclusion tend to provide a bundle of services that sort of combine cash, services, training, coaching, access to credit, and the like, with the goal of building households' income, building their assets and resilience. But in Nepal, there are livelihood programs. MedPA is one, for example, and there are other programs at a small scale. But again, they're not really linked to cash transfers and social protection programs as such. So that's the last slide on on the challenges, now I move to recommendations. The first one is increasing investment in early years, increasing the poverty impact, making sure programs are responsive to shocks, and organizing a policy framework. So I'll go over each of these quickly. As I mentioned before, the child grant benefit amount is rupees 533 per month. This could be increased. The government is also gradually rolling out the child grant beyond in additional districts each year. Currently, it's in 25 districts. That could be continued. And sort of connecting all the programs in the early years would also increase the cumulative impact. And here, so the Safe Motherhood program incentivizes delivery at facilities. The rate of delivery at facilities in Nepal right now is 77% based on mix. Birth registration under 12 months is still at 60%. So connecting the two would help raise the registration rates. Similarly, connecting them to other services would ensure that the child gets all the services it needs. The second area, how do we increase the impact of poverty? So there's the program that is currently operational that targets the poor is the Prime Minister's Employment Program. However, it is not implemented at the scale that it needs to. If we look at the number of registrants last fiscal year and this fiscal year, there were over 700,000 people who applied for PMEP. The budget allocation is for 200,000 people this year. So there's a huge sort of under financing for this particular program. So that could be scaled up. The second one I want to mention here, in the Social Security Act, there is a provision for cash transfer for the economically poor, but this hasn't been implemented yet. So that could help reach a number of poor people. And the third one is again about sort of combining, coordinating these interventions so there's a greater poverty impact beyond providing individual services or transfers. Third area is to do with increasing the shock responsiveness of programs. As I mentioned earlier, this requires a good information system. And the recommendation here is to establish an integrated social registry of households. And the government of Nepal is already moving towards that. There's an agreement to build the registry, and design and development of the registries actually has started now within a World Bank finance project. And the government sort of plans to establish that. The second area is to make sure that the programs are flexible, scalable in design. And scalability or flexibility need not always mean adding benefits. It could also mean changing the criteria for eligibility, delivering transfers at a different time than is normally scheduled. Third is to do with financing. And the fourth, as I said before, so in Nepal, the Disaster Risk Management Authority and the Social Protection Implementing Authorities are not institutionally linked for this. There are now conversations, NDRRMA is talking about developing guidelines, shock responsive social protection, whereby NDRRMA would be responsible for looking at the shocks, monitoring the shocks, defining thresholds for triggering the social protection scale up, and the social protection implementing agencies would then be responsible for delivering the additional services or benefits. On the policy side, then there's a need to adopt the integrated SP framework and define better the objectives of social protection. And also in a federal context, there is not a whole lot of clarity in the roles of the federal, provincial and local level, particularly in social protection, which is a concurrent function. And I already talked about social registry. And the registry is meant to be an information management system. And it's a database of households where there would be individual identity information. So each individual would be identified, but linked to the households. And there would be demographic and socioeconomic data. And in separate places, the government of Nepal already has these data. So the question is about integrating them to have it in one place for use by all social programs. So I outlined a few recommendations. The next question is it affordable? And we did some very simplistic simulations to look at how much this would cost. I emphasize that these are very simplistic simulations and slightly dated now as we use the data from starting with 2020. So what we did was to look at the current programs and what the cost was. And in 2020, the estimated cost as share of GDP was 2.1%. We've kept the coverage rates constant, but indexed the benefits to inflation. So we've projected the cost based on that scenario. And in subsequent scenarios, we have changed the benefit size of the program coverage. In the first scenario B1, we've increased the benefits of child grant for current beneficiaries and then done it for all children across the country. In scenario C, we have expanded the coverage of the Prime Minister's employment program, which we expect to help with poverty impact. And similarly, in scenario D, we sort of estimate the cost for a transfer for the economically poor. And the column on the right tells you what it would cost in terms of share of GDP. Altogether, we estimate it would be about 1.4% of GDP if all of these reforms were sort of implemented all at once. In the next slide, I present sort of the actual cost in billions of each of these reforms in the top, and then in the bottom as a share of GDP. In nominal terms, in 2020, introducing all of these would increase the total cost to about 138 billion, which is about 50 more than the current, which does seem like a large jump. But this fiscal year already, the government of Nepal announced SSA increase by a third, which was an increase of about 30 billion in one go. So this isn't sort of beyond the realm of discussion, I think. So I probably shouldn't spend too much time on going into this graph. I will conclude very simply by saying the expenditure in Nepal is high. The expenditure is achieving some outcomes, but there are several challenges still. And there are ways to address these challenges, and the fiscal implications of these reforms don't seem too far out there. I will stop there and pass it back to Satyamji. Thank you.
Thank you, Ms. Pandey. This is really an interesting presentation and very comprehensive as well. I think in recent days, I have this is one of the really comprehensive on this issue I've read or seen. So thank you very much, Mr. Sharma. I would like to give the floor to you, and then if you could take a few minutes to comment on Ms. Pandey's presentation, and then we can open up the floor for questions, queries, and feedback.
Thank you, Sudhumna. Thank you, IIDS. Thank you. Let me address you as a colleague because all of us have been concerned with the well-being and welfare and economic development of the Nepali people. So that concerns binds us together, whether we work in a different, all kinds of field. Some are students, some are researchers, some are kind of on the verge of retirement like me and the others who have been building their careers. But they all see hope in building a very strong, vibrant society where inequality and discriminations will be a thing of past. We need to fight on all those issues. I think first, I'm not an economist, and I do talk about policies and programs, schemes, basically in a social protection, social security things. There's a conceptualization, what you wanted to do, what is your aim, and how do you materialize? How do you actualize those imaginations and those hypotheses in reality? And where number becomes important, resources become important, and forward-looking directions are important. And I think I should congratulate Jyoti and our group for putting up, a very. I went to the little bit of a document and found it very interesting. It does diagnosis. It does put in things into a comparative perspective, and it talks about restraint, the constraint and restraints within the system, and how much it would take. Ultimately, the policy planners would like to know how much it take to actualize the policies and the programs. And I think this is what public policy means. But I come from a different trajectory that I do a fundamental questioning. And then I think Jyoti has also raised very important question, which is basically the imagination of equal just society is a constitutional imagination. In our case, it's a quest of a humanity to be just and equal. But in terms of territoriality and politics, we have a constitution which says that Nepal is a just society. There are other rhetorical claims, which I don't want to go into constitution, for example, move towards socialism and something like that. These are basically lofty things. But basically creating a just and equal society is important task, and what kind of resources, what kind of interventions are needed. And I think the report makes contribution to that. What I found very interesting but missing in this discussion, maybe in a larger discussion, and that's a very important question that I think all of us are kind of aware of, that the question of accountability, basically. Who spends, how much is spent, why it is not being done. Basically, where lies the accountability? Constitution says such so and so, government makes policies. There are different bottlenecks, there are problems, but ultimately we live in a democracy, and where does accountability lies? Who answers that ultimately? So I think in this kind of discussions in the reports, I don't see this as a kind of activist advocacy kind of document, but people can use these resources and this research for their advocacy purpose. Look, Constitution says this, as Jyoti has rightly said, bundle of services has to link with the bundle of rights, because I come from the rights perspective. Services are required, services needs to be guaranteed because it's constitutional right to get those things, and rights and the services. And then I think the bundle question comes from Hannah Arendt, and I read political theory, right to have a right is a basically fundamental right. So in that sense, who ensures that service? So, and then again, constitutional values and periodic government policies needs to be properly understood. Constitutional values cannot be compromised as long as there's a constitution. Government policies can be reviewed periodically based on preferences, choices, that this is where you have a flexibility. So social protection, social insurance, whatever the social gamut of social policies, is it a constitutional requirement or a government of day? Generally what I've seen, and this is a problem, that the government of day wanted to, what you call any government of the day, wanted to dole out things, wanted to be seen progressive without realizing the fundamental values, how they wanted to keep on. So I think there is a tendency among the politicians to win quickly and get their own way. So I think this is where the accountability is also linked. For example, universal education, how many times you need to reiterate again and again? Universal health, how many times you need to reiterate again and again? Is there a permanency? If it is a constitutional value, right to education for all, or education, can it be be properly thought out? And government of the day come and go, but they need to add the brick layer by layer, build the foundation properly. And because of this accountability question and quick fix of the political the bosses, I find a problem and undermining the constitutional imagination which they have themselves founded. So one of the major accountability question I wanted to raise, because it's a large audience, that who needs to own the constitution and the process is not owning. The blame squarely lies with the political masters of this our country, because they see these kind of policies and program a quick fix rather than laying down the just and equitable society for which this kind of report, this kind of analysis contributes. So with a little bit of different angle, or this is my perspective, I wanted to open the floor for a discussion. And I know there are many students and the researchers and people who have been working on this field. I think the presentation that Jyoti did would definitely raise interesting questions, comments, but we have a time, and I would like Sudhumna to help me to keep the time. And I will also try to read the chat and whatever question has come, I will direct that. Okay, there is a question from Ram Saha, who is asking a question, says that what is a conceptual difference between social security and social protection? I will take a couple of questions. Yeah, if there is a couple of questions, then let's take a couple of questions. Otherwise, there is only one question, Jyoti. What is the difference between social security and social protection? This is asked by Ram Shah.
Thank you, Hari sir. There isn't really, at least in the way we are using the terms in Nepal, the two are being used interchangeably, and there isn't really a difference. In Nepali, सामाजिक सुरक्षा र सामाजिक संरक्षण पनि भन्ने गरिएको छ. But when we are defining and what is covered under those, we use the terms interchangeably. Different countries use the word slightly differently, whether social welfare, in Europe, social welfare is used more commonly, social security in the US, but social protection sort of covers both of those. And in Nepal, I would say there isn't really a difference. Thank you.
Thank you. And there's another question coming in from Kushal Pokhrel, who would like to know, where does the idea of a social security fund announced by erstwhile Holy government fit in the broader discussion of social protection?
So the schemes under Social Security Fund are contributory schemes. And in the larger picture, there should be programs that are both contributory and non-contributory. If you look at the fiscal burden, the state cannot provide everything indefinitely. So for those who cannot contribute, the state should provide, and that is what we call social assistance. For those who can contribute through their employment, through the income, through their employment, so you contribute some of it and the employer contributes some of it, and then from that, the schemes under the Social Security Fund, there's medical and disability, medical and accident, disability, survivor benefits, and old age pensions. And the idea is that the employer contributes some of it, employee contributes some of it, and then you derive benefits out of the total contribution. Fiscally, it allows the state to sort of distribute the costs. And it's also the idea that those who can contribute should contribute. I see there's a follow-up question.
Supplementary question. Yeah,
why
there's a supplementary question coming.
Fund didn't
receive
when it was launched, it was launched with great fanfare. I do think the implementation has faced quite a bit of challenges. The uptake remains quite limited. And there are several challenges, I would say. The contribution rate is 31%, 20% by the employer, 11% by the employee, which is quite high if you compare it to other countries. And the fund is meant to cover both formal sector, informal sector, and self-employed. It has started with the formal sector. Some in the formal sector who are currently receiving benefits through their employer and otherwise are claiming that the contribution rates are too high. The others who are in the formal sector but not receiving benefits, this would add to the cost of the employers. And there's probably some communication challenges as well from the state to the employers and people. So there's several challenges why it hasn't sort of picked up as expected. And there's probably a political angle to it that Hari sir can probably speak to than myself.
I think there is a question from Praveenji, and then you can read it to Jyoti. It's about the data and your work.
You want me to read it, Hari sir? Or
yeah, please, please.
First of all, thank you so much, Ms. Pandey, for your wonderful presentation. We at the IIDS were extremely grateful. My question is related to, because your background is with the World Bank, so since this study seems to have originated as part of the World Bank work on social protection, my first question is, do we have figures related to how much of the total DP funds go into the social protection?
I don't. Actually, the funds that go via the government treasury are accounted for, but I don't have a share of that. The funds that are sort of outside through NGOs, INGOs that don't go through the government treasury are not included in this figures. We only looked at public expenditure in this report. So I don't have a share.
Yeah, of course.
But the larger programs are financed by the government of Nepal. So the social security allowances are financed by the government of Nepal.
Right.
The schemes under health and education, there is a sector-wide approach whereby there is a basket of donor funding, and it sort of contributes to all the programs under the sector. So how much of the health and education is donor funded, I'd have to look up. But in social protection, I would say the share is quite small.
Right. So maybe, I don't know, maybe in your report or in a presentation that might actually, help. But only my view. And an interrelated question is, and this might be a little bit, sensitive because of your association with the bank, but, how are the different DP development partners' agendas related to social protection? How does it affect Nepal government's approach to social protection? Because, for example, we're very much aware that the Swiss government is really keen on federalism, the 3 tiers of government, right? Whereas the 2 banks are really, interested in infrastructure and all that. For example, the Prime Minister's employment program is primarily funded by the World Bank. So I'm just curious to know, are the different DP agendas, influencing the Nepal government's approach to social protection issues? If it's too sensitive, just, you can answer it in a different way.
I can try to answer it. Social protection is quite an important agenda for the government of Nepal, politically, economically, etc. So the larger programs are driven by the government. Where we come in and try to influence the agenda is to do with better delivery, better coordination, better implementation, and where we see gaps in terms of people who are entitled to but not receiving, like I said, there really isn't a conversation around social protection and poverty. There we are trying to bring it, sort of have a discussion on such things. Where it relates to federalism, PMEP, the Prime Minister's Employment Program, yes, it is meant for sort of small infrastructure building and maintaining it, but our involvement is more from a social protection side, where we say people who are poor and vulnerable should get a minimum wage, minimum income throughout the year. 100 days that's where it comes from, right? It's meant to realize the right to employment rather than necessarily create infrastructure. So infrastructure creation is part of the program, but the entry point is a social protection angle. So where analysis tells us there are gaps, we do try and bring it out and influence, but I think social protection is not sort of, there is already a government agenda. So we are trying to come in is to do better information systems, better coordination, better delivery, and ensuring that people who are already entitled are actually not left out. So when we talk about sort of coverage, there is quite a lot of talk about duplication. So, people receiving multiple benefits. There is very little evidence when you look at survey data, but there is anecdotal evidence of people receiving. And that seems to get more sort of airtime than the question of under coverage, where people who are eligible are not receiving, right? So we want to bring that into the conversation. And about federalism, I don't think federalism and social protection are sort of agendas that are sort of going at different sides. They are together. Social protection now has to be delivered in a federal context, right? The governance system is not outside of that. What we are saying is, in a federal system where social protection is a concurrent function, the functions are not defined very clearly. The unbundling report doesn't go into that level of detail. And I think the federal government should define a minimum and we finance a minimum of social protection. So that should come from the federal treasury. But then the local governments and provinces have the mandate and are already providing sort of add-ons and specific programs depending on the needs of the population in that territory. So I think the federalism actually allows social protection to function better. And the coordination challenges, I mean, if you look at health, education, and SP, previous to federalism, there were completely different vertical line agencies. District health had nothing to do with district education, had nothing to do with the rest of it. Now, local levels are the front line of all of these services. And there is the opportunity to then actually coordinate these services better to get the desired impact. I stop there.
No, thank you very much. Thank you very much.
Just a quick note. Could all the participants please share their questions on the chat box, please? That would be helpful because some questions are going probably personally to the speaker or to Mr. Sharma. So please send your questions on the chat box so that everyone can see. Mr. Sharma, I think Kriti Subedi has been on the line holding hand for a question.
Thank you. May I speak? Yes. Thank you.
Please.
Very nice presentation and very well coverage presentation. Thank you for Ms. Pandey and Hari Sharma. And I also like to thanks to IIDS. I'm working in local government and I'm a social protection scholar. I'm PhD scholar of social protection. And then I'm also a student of social policy in Pandey University. Then this is very interesting and useful for me. There is so many queries about social protection. I think during my research, my study, is our current social protection scheme are working well or not? Just I asked to you, the life expectancy rate is currently is 59, while they get in 60. Dalit life expectancy in only 54. Only they get after the 60. Brahmins average life expectancy is 69, and they only get after the 70. This is census data of 11. But only those people is catching this who have sound economic status. Our very few amounts we are expanding on social protection. So some of people out of social protection umbrella, like street child, we are not covering. Homeless people, we are not covering. And we are telling our government is doing very better. And the distribution patterns, governance system is very poor in social protection. Some funds of social protection being misused while it is distributing. So there are so many issues and challenges, and here is some improvement. We need so many improvement in the sector of social protection in the governance. Our school system, our education system, and other over services we directly provide to people are very poor. So if we give them healthy environment, healthy education system, and then the social protection also covered to all, for this I think this is very fruitful. But I think there one should be government representative from our ministry. Then it is quite debatable also.
Kriti, please.
Okay, thank you.
We are running out of time. Very interesting questions from, I think more than a question, I think it's a reflection. Basically, he has raised many interesting questions in terms of his intervention. Who would like to go? I have something to say at the end on that question also. Are you going to, Jyoti ji, would you like to comment?
Reflect quickly. I mean, the larger question of are they doing well? They're doing okay, but there's a long way to go. There are many, many challenges in implementation. I agree that there are coverage issues. Everyone who is currently entitled isn't getting the services. And everyone who needs the services and benefits from the state is not getting it. So there are issues in expanding coverage. You raised a question about misuse of funds. I agree. There have been cases of misuse, particularly with the delivery of the Social Security allowances. There are many stories, and still we hear once in a while stories of abuse. There are some systemic reforms being implemented, some supported by the World Bank. For example, the Social Security allowance used to be delivered in cash, which exposed it to irregularities. In over 500 local levels, now the cash is being delivered into beneficiary bank accounts. And in the transition, a lot of the sort of irregularities have declined. Because a lot of duplicate beneficiaries or fraudulent beneficiaries have been removed from the system, because opening bank accounts requires KYC, sort of additional verification in the system. The databases are now electronic, not manual. So there are reforms underway to address some of these challenges. I stop there, Hariji, pass to you. And there's another question about PMEP, which I can come back to.
Yeah, I think Sirzana Koirala has asked the question on PM employment program. She says that it is not having any effective outcome. So what needs to be done in terms of, effective PM employment program? This is basically
So I agree, implementation of PMEP has faced many, many challenges. I would start by saying there is a need for such a program that is targeted to the poor and unemployed, whether it's cash for work or cash or something else. So this is the only program that targets the poor. So I think it's very useful to note that. It's only in its 4th year. It's very, very new. And it has come at a time when the country was transitioning to federalism. SSA has been operating since 1996 for over 20 years, almost 25 years now, and there are still challenges in implementation, right? I think the criticism of PMEP is valid, but I think we should allow some time. And there are sort of systems being designed to help sort of improve the delivery of Prime Minister's Employment Program. There's a question of scale, but before it can be scaled up, the delivery capacity has to be strengthened. I agree. And then it is a federal program, but meant to be implemented by the local level. So there is some gap in coordination or ownership between the local level and the federal level. And what also doesn't help is the different timelines for planning and budget allocation. Local levels have a timeline. The federal allocation comes at a certain time, which doesn't allow enough time for it to be integrated in the local planning, the selection of projects. So there are several parts to it, but there are sort of systems being developed and reforms. There are interactions being organized by the federal ministry with the local governments. So I think we should see an improvement.
Thank you. And there's another question, basically, what is the indicator of a capacity of a country to take social protection responsibilities? What needs to happen? I guess this is the question. It's a very interesting question. What needs to happen? What is the architecture, or who needs to do what kind of skill sets we need to implement these programs and policies? I think this is what I understood. I don't know.
Yeah, 3 parts to it. One is policy clarity and sort of clarity about responsibilities of different levels of government, which is, I think, an ongoing exercise in Nepal. The second is capacity of the people who are delivering these services. Local levels right now have a lot of mandate and a lot of unfunded mandates, I would say. So there is a lot of capacity building that is ongoing and needs to happen at the local level, who are the frontline service deliveries. And the third aspect is the fiscal capacity, which I talked about earlier. Over. Back to you, Hari sir.
Sudhumna, how are we doing with the time?
I think we still have a few minutes more. So I think there is one question that we missed out. I think, Mr. Sharma, shall I go and read out from Asta?
Yeah, please.
Yes. So since the presentation says social protection in Nepal is already high next to India, is the way forward to increase the social protection fund or to stop the leakages, that is target better and ensure it reaches the target audience better? So that's the question. So I think I would just like to add one issue on exactly on this point. So pretty good, we know that we are spending quite high relative to many competitor countries, and the desired effect that the outcome that we want has not been sort of achieved. So we see that there is a plethora of programs, right? If every government comes and they announce something, the other government comes, they announce something, and your analysis also shows there are hundreds of programs there. So did you, was the team able to do what programs actually could be scrapped? And then, because you see, there are two benefits out of that, right? So one, those programs can be scrapped, and then that money can be rechanneled to other social protection scheme. That already is a saving in the fiscal sort of the whole scenario. So has the team done any analysis on that front as well? And can it be publicized, or can it be made public?
I think there's a need to do both, spend a little more, but spend better as well. Some of it is to do with better delivery of existing programs. In terms of what can be scrapped, there's a lot of smaller programs that we haven't looked into in a great detail, but the smaller ones are a small share of the spending. Besides the 5 programs that we used in the simulations, all the rest of it is about 5% of the total social assistance. We can look into that and have sort of build in efficiencies there too, but not a lot. In terms of duplication, so if we look at health coverage, so there's the national health insurance as well as the health scheme under the Social Security Fund. The two are quite different in terms of the contributions required and the benefits available. So there's a little bit of a duplication there, but at the policy level hasn't quite happened at the implementation level because the coverage of both are quite small. Therefore, again, for health, there's the Poor Citizens Medical Treatment Fund, which is in addition to the health insurance and others. It is meant to cover certain diseases which are expected of higher cost, but again, there's some duplication there. Health insurance, again, the premium is meant to be subsidized for senior citizens who are now receiving 4,000 rupees. Can you look into that is a question. And then the largest cost item in social assistance is SSA, and the senior citizens are the larger group of the recipients, right? The benefits were increased to 4,000 rupees. There hasn't really been a conversation around what is that 4,000 supposed to do, right? What is it for? And it is given evenly across wealth quintiles. A rich 70-year-old gets 4,000 rupees, a poor 70 also gets 4,000 rupees. Can there be a variation depending on wealth? Maybe the richer ones can receive a little less and the poorer receive a little more. So there are ways to sort of do savings within the current envelope as well, but I think there is a little more that is needed. Over.
But then so how do you go about actually, so what's the thinking in terms of, so I mean, my father who actually doesn't need the social security, whatever allowance that he gets monthly, he actually doesn't need it, but he still gets it, right? So, and he goes and donates that money to somewhere else. So how do you actually, how do you create a database system that to identify he does not actually need it? So what's the thinking on that front currently?
So the government of Nepal already has an initiative underway to identify poor households. The Ministry of Land Management, Cooperatives and Poverty Alleviation has been doing this exercise for a while. 26 districts were surveyed. There was a census done among households in 26 in 2013. The list of poor was released. There was some debate around sort of the accuracy of the data. And in the last 2-3 years, the ministry is again doing these collecting data to identify poor households. There are some issues around the data collected, the methodology and all of that, but the government is identifying poor households. So once it is possible to identify who's poor and who's non-poor, you can vary the amount of benefits that goes to the poor versus the non-poor, and it can be on a scale, right? I don't necessarily advocate that a rich person should get nothing. And the way senior citizen allowance has been understood in Nepal is sort of, recognition for your services to the society, so those things like that. The recent law doesn't say that, but that's how it was used to be said. So others can continue to, but then when it's increased, maybe the richer the benefit amount is not increased for so over a period, I think there's ways to adjust it. And then where there is a need to increase is the child grant, which is meant to be for nutrition, but it's 530 rupees. And it doesn't really buy a lot that would achieve nutritional outcomes. Over.
There is one question from Pragya Thapalia, which is about, accessing the services, and barriers are basically documentation for the people with the disability, elderly. Could you please explain if there is a special provision for this population, the elderly and disabled people with the disabilities, to access the documents and access the services of the social protection?
So lack of documents, either identity documents that verify citizenship or documents to verify your status of disability, is a barrier in accessing these services. So a lot of, I shouldn't say a lot, but some children whose parents cannot verify their citizenship and their births are not registered, then they're not eligible for the child grant, because you need to have your birth registered. And for whatever reasons, if the mother can't go and register, and a lot of local level officials still say, despite the fact that either mother or father can go and register, still ask for their father, and that whole discussion around citizenship and gender and all. So that has hindered some access to social for child grant. With disability, earlier the district or women's offices were responsible for screening disability. Now that function has been devolved to the local level, and the capacity to assess, because it's a medical, it requires some medical expertise to assess disability. So the capacity across the 750 local level is not even, and some local levels are facing challenges in screening disability. And although these rights or these transfers are presented as entitlements, you still have to show up and claim it. The state doesn't yet sort of come to you in Nepal, right? You still have to go and sort of the delivery doesn't come to your door. You have to go and claim it. And those who cannot afford to travel, those who have other reasons why they cannot go and certify their disability or apply, are still missing out. But there are efforts to there are a lot of sort of NGO supported programs which do case management, look at specific cases and try and resolve their paperwork, or provide travel costs for them to go and have their disability screened. So there are efforts towards this. Part of the World Bank Finance Project also looks at sort of better communication and awareness about these rights and how to access them. At the end, there's a question about digitization. So SSA, the beneficiary list across the country has been digitized, and new entries have to be done into an information system. The civil registration itself is being digitized, and it's done digitally in 3,000 words or so, probably more, maybe 5,000 words. So there is also efforts in digitizing the service delivery across the board. I stop there.
Dumna, time.
Yeah, I think we are almost there. We could, if there is like last burning question, probably we could take one. Otherwise, we are almost there.
Okay. I guess.
Mr. Sharma, there is one from last, probably from Pragya Thapalia.
Hi,
So
Jyoti.
that's what we.
Okay. Yeah. Sorry. Can I ask my question?
Please go ahead.
If that's okay.
Please.
Okay. Thank you so much, Jyoti, for clarifying the questions. Regarding the last question, I think I phrased it a bit incorrectly. It was about, as you mentioned earlier, that the government doesn't really approach the beneficiaries itself. But since we are moving towards a more tech-embracing society, are there any provisions of maybe perhaps transferring or talks of transferring the amount directly to the beneficiaries' bank accounts or something like that?
So the transfers are being done into bank accounts. There are still, I think, 3 local levels which don't have a bank branch that's accessible functioning. In over 500 local levels, all of the Social Security allowances are being deposited into bank accounts, but access to a bank branch and access to the cash once it's deposited remains a challenge because of the coverage of the banks. So in terms of payments, there's been a lot of progress. In terms of registration services, now you can apply for a birth registration or a death registration online. You can fill out the form, but you still have to physically be present at a ward office to then print and then sort of put your thumbprints on the documents. So there have been improvements on both those fronts. Over.
Thank you. I think we're done.
Yeah, I think we are almost there. So on behalf of the organizing committee and IIDS, I would like to thank both Ms. Pandey and Mr. Sharma for their time. This was really very lively discussion. I thoroughly enjoyed, and I hope everyone in the forum enjoyed as well. I'd like to thank everyone in the audience for joining in and asking interesting questions. Next month, we'll be back again on first Monday, that is February 7th. Till then, everyone stay safe, and thank you very much. And thank you very much for your time. Mr. Pandey, Ms. Jyoti, and Mr. Sharma, thank you very much again. Really appreciate your time.
Thank you. Thank you. Thank you. Thank you. Bye.
Bye.